Dr. Arapakis, I know, is going to be doing a case presentation with Meri. So thank you both for your time, who's here today to support this amazing team in North Macedonia that's changing the world. So thank you very much. And I look forward to seeing you guys a little bit more next time.
Yes, thank you, Vale. Thank you. Thank you again. And thanks for joining us. It was wonderful to have you, even though it was brief, short, and sweet. Yes, yes.
Bye, guys.
Bye, Vale. It is my honor and pleasure to introduce Dr. Iakovos Arapakis. He is an ENT physician, and actually, Dr. Arapakis, you can introduce yourself briefly.
My name is Iakovos Arapakis. I studied in Germany medicine, and I made my medical education in a big university clinic in Freiburg. It was a big otologic clinic. And further on, I did my further education in Stuttgart, and I worked there as sorry.
Yes.
And I worked there as a consultant of ENT. Since 2011, I work in Thessaloniki, and I have my own ENT clinic and do my surgeries in some private clinics here in Thessaloniki. Meri, I give you back the words.
Yes.
You can present the study, the case, and then I will give some recommendations. Thank you very much.
Yes, thank you. Thank you so much. For 1.5-year-old child with Down syndrome and autism, suffering from recurrent middle ear infections and speech and language delays. Autism was suspected by me, and it was confirmed later, but he was 1.5 years old when Dr. Arapakis actually did the intervention that he did. So we are also facing some current issues now, and this is the reason why I am consulting Dr. Arapakis again, and the difficulties that we're actually experiencing is that he is 4.5 years old now. He had few surgeries. Dr. Arapakis will share that part. But about the hearing part, because the PE tubes were placed and all the interventions, into important, crucial interventions about his hearing that were supposed to take place, did take place. Thanks to Dr. Arapakis, he did develop oral speech, and he is a good functional communicator. He's generally healthy. He's not on any medications. He even attends preschool. He's in a small size classroom. He does have a special educator who is with him during the whole school day. He is receiving current continued speech therapy 3 times a week. He has occupational sensory therapy, sensory integration therapy, and physical therapy. But what the issue is at this moment, the parents have consulted me to see him again, and when I evaluated his speech, his patterns do not resemble the typical Down syndrome patterns of Down syndrome speech. We do know that a lot of children, most of the children with Down syndrome will have recurrent otitis media when they're smaller, when they're infants, when they're toddlers, and they will have hearing difficulties and issues, may have throughout their lives. Not all, but quite a bit of them. But so because he is not wearing his hearing aids at the moment, because of the COVID pandemic, he's also not really communicating well and cooperating with the other physicians. The way he sounds, I think that there is a hearing difficulty again, and the family has had 2 failed hearing exams due to his uncooperativeness.
Thank you very much, Mary. I
Yes.
sincerely appreciate your welcoming and warm introduction, and I would give a short insight of our case. The 18-month-old child had a suspected hearing loss, and in microscopic examination, I found glue ear both sides, and the endoscopic evaluation showed us a hypertrophy of adenoids. Consequently, we decided to perform the following 3 steps in one procedure in general anesthesia. First, the imaging of CT and MRI. Second, the surgical procedure with adenoidectomy and the placement of ear tubes. And the last, the testing of hearing. I start with the imaging because we made the imaging because we didn't know it's a complete hearing loss. Perhaps the child needs later a cochlear implantation, therefore we had to do imaging. The MRI showed normal findings of the anatomy of the internal auditory canal with normal facial nerve and vestibulocochlear nerve. The computed tomography also showed us normal findings of the temporal bone without a malformation or an abnormality of the inner ear. We were happy to have these imaging findings. The next step in the same procedure was the surgical procedure, included the removal of the hypertrophic adenoids and the microscopic placement of the ear tubes, so-called grommets, after suction of these fluids inside the middle ear. Our purpose was to have better ventilation for the middle ear and restore the natural passageways from the middle ear over the eustachian tube to the nasopharynx. In addition, the last step in this procedure was performing the testing of the hearing. We use this ABR, auditory brainstem response, to test the inner ear function and brain pathways for hearing, recording the brain wave activity in response to the given sounds. The frequency-specific ABR testing showed us at 1000 Hertz, 50 decibel both sides, and at 4000 Hertz, 40 decibel both sides. In conclusion, the ABR results were consistent with a mild to moderate hearing loss. And we were very happy with this result because we thought the child has a complete hearing loss, but we were very happy. We recommended supporting the child with hearing aids, and you heard from Meri the good performance the last months and years with the development of this child. I will accomplish the following. There are plenty studies in evidence-based medicine which report that in small populations, for example in Iceland, in Northern Europe, the early provision of the ear disorders has the best long-term results. Taking all the above into consideration, it should be clarified that the sooner you intervene for a better tube ventilation, the better are the results, and it leads to less chronic otitis or cholesteatoma. This is very important to know this. The earlier we intervene, the better are the results. And I thank Meri again for this good collaborating we have the last 5 years, and therefore our work has been fruitful and efficient. And I wish us good luck for the future, and thank you to participate in this meeting. Thank you very much, Meri.
Thank you so much. And I do know that you actually have to go immediately to the operating
The
room.
question here, yes.
So I am very grateful to you for waiting so patiently. And there will be, I hope, another occasion when we can speak and address other issues as
Yes.
well. Thank you again.
Thank you again, and all greetings to everybody in the audience. Thank you very much.
Thank you. Thank you so much.
Thank you guys so much. This was wonderful. It was great to hear both of those presentations. I thought they were very interesting, and it was nice to hear it from another perspective. All I hear are things in the United States, and so it was just nice to hear something from another perspective, but yet the same. Yeah.
Yeah. I see. And Robin, can you introduce yourself very briefly?
Sure. I'm Robin Hardesty. I am with Echo Autism Communities here at the University of Missouri in the United States.
Wonderful. So very, very welcome. Wonderful to have you. We're very much looking forward to meeting with you next time. So thanks again.